My name is Jasmine Edwards. I'm a music therapist and I live in Brooklyn. I'm the music therapist for the neonatal intensive care units in the Mount Sinai hospital system. So I work for a department called the Louis Armstrong Center for Music and Medicine. My favorite thing about music and music therapy is how people are able to connect through music and how music can foster relatedness between people. And I've noticed that music has this immediacy to our emotions that many other things do not, and oftentimes concepts that are difficult to express or verbalize can really be shared through music much more easily than through words. So I think music as a point of connection is like the bigger theme as far as how music can improve our overall well-being. It really helps us to connect with other people, which is a hallmark of healthy development. At Mount Sinai Hospital, Dr. Joanne Lowy had a research study several years ago that was published in Pediatrics. And she was looking at how live music interventions affected the physiological state of infants. So a lot of what this research uncovered was how we can use music to help soothe and calm and slow respiratory rate if the baby's very agitated. There's an intervention that can help to slow breathing and help the baby transition to a calmer state where they're conserving energy, which is so important for infants who are born prematurely. We have an intervention that helps to slow heart rate, again, regulating the infant. And that same intervention also can help with sucking response and strengthening that response that isn't fully formed yet, but is of course crucial to the baby being able to go home. So we know all of this, and now our study is taking those live interventions and applying them to working with infants born with NAS. So we have already seen how music can help physiological responses, and now we're looking even more specifically at infants born with this specific diagnosis. In terms of trauma-informed care, having a premature infant can be a trauma in itself because it's this atypical situation where your baby came earlier than expected and isn't home with you, so you're not able to really build upon bonding as it typically happens when you bring a baby home from the hospital. So that alone disrupts how bonding happens. So music, the element of music in the hospital can really help provide that opportunity for bonding that might not otherwise be there. So seeing a parent using a lullaby and singing to their child and focusing on their child and really seeing that relationship start to form can be really impactful, and music is that holding force there for them that provides comfort not only for the infant but for the parent. And I've had a lot of instances where maybe a parent wasn't able to talk about how they were feeling with medical staff, but as soon as they hear a certain song or let themselves listen to the music or even participate in it, this like catharsis happens, like maybe there's tears or just some kind of release happens. And I think that is really a part of the unique element that music can bring into a setting that can be very stressful. I think something that's important about our work in the NICU is that we are not only concerned with the infant's care but also the caregiver. So that could be hospital staff caring for the infant, nurses, doctors, but also the parents or any other person who is taking care of this child. And we look at more of a family system and how the infant, the caregiver, and the environment as a whole, the other noxious stimuli that are coming from the machines in the NICU are all overlapping and impacting one another. So it's really this holistic stance about how music interacts with the hospital environment. I would like to see a few different areas explored in the realm of music and health. I'm really excited about this research with NAS because it's such a current issue in our country. So I feel excited that this is the first study of its kind, and I hope that there'll be more to follow. I always feel like we could investigate working with children and how children respond to music and how it can really aid in their development overall across various diagnoses. I also am very interested in music therapy research that deals with cultural considerations as well and how that manifests. I'm really curious to learn more about the role of race in trauma-informed care and things like epigenetics that we're getting a better understanding of. I feel like there's a lot of room for investigation in using a person's music from their own culture, be that racially or be that just from their family makeup. Those are the areas where I think there's like some kind of potential.